I'm Dr. Anuradha, Senior Consultant in Obstetrics and Gynecology at Ankura Hospital, LB Nagar. I'll be talking about polycystic ovaries. PCOS has become a very common disorder these days, basically because of our lifestyle changes. So PCOS means nothing but having multiple small bubbles on the ovaries. So what is the problem if there are multiple bubbles on the ovaries? Usually whenever there is PCOS, they will present with irregular cycles. So the problem with irregular cycles is they're not able to predict when exactly they're going to get this cycle, and then if they have to travel anywhere, they need to be prepared for their menstruation as well. So that is one problem usually seen in young children. In the second category, say in the reproductive age group, there is always a risk of having difficulty in conception. This is because of anovulation. The egg does not get released, and as a result, they have a risk of having infertility. Maybe if they approach the doctors will be able to help them. And over time, if this continues to the middle age, then there is a risk of having abnormalities of the uterus and various other changes that can happen in the body as well. So polycystic ovaries is basically a lifestyle disorder. Why do we call it as lifestyle? Basically because of lack of activity. There is decreased activity among the present generation, and there is also increased intake of junk food. So what exactly is junk food? One could be anything that has lot of sugars and lot of refined stuff. So what is that is rich in sugars? It is usually the juices. It could be your colas. I have no intention to harm anybody, but it's basically these are some things which are rich in sugar. So all your juices, also your packaged juices, are all rich in sugar. So try to avoid these, and preferably try to eat fruits. So this will have more fiber and your tummy will be full, and you will not want to take lot of other junk food. And whenever you take lot of sugar rich diet, you tend to have more cravings and you will eat more of it also. So try to cut down on anything that is rich in calories and rich in sugar as well. And the second is inactivity. What kind of inactivity? Usually most people are either sitting at their benches, either because they're reading or they're doing something like a software job and all that, so they don't move out of their place. So ensure they spend at least about 10 to 15 minutes every day, maybe in the morning or in the evenings, as in when you are free. Try to spend some time in doing some kind of physical activity, and that way your hormones will get better and your problems of PCOS also will decrease.